So welcome to this webinar for VISTAs on changes to your healthcare benefit, understanding your options. Please note that this session is off the record and is not for press purposes. It's expressly for the benefit of our VISTA members, leaders, supervisors, and sponsors only. I'm your host, Andy King, with the training team at VISTA headquarters. Our presenter today is Kim Judy, who until recently worked here with me in the member support area at VISTA headquarters, but she recently transitioned to our program office in New York State, where it's very cold today. And so it's great that we have Kim with us. She is quite expert in the topic for today's session, and she has a lot of great information to share. And so now I'm going to turn it over to Kim.
Thank you, Andy, and welcome VISTAs and VISTA sponsors. We know that you are all aware of the Affordable Care Act, and today we're going to spend some time on the specifics of the health care law, the benefit that it offers you, and also the health care benefit that the VISTA program offers. We are also going to discuss the changes that VISTA is making to the health care benefit that we offer during your year of service. As a currently serving member, you'll have the option to take advantage of the changes we're making or to continue receiving the benefit we currently offer you. Today, we'll share the changes with you and give you the steps you need to take to make a decision regarding your benefit. We will present a number of resources during this presentation. Please understand that the list is not a complete list and should not be taken as an endorsement by the VISTA program or the Corporation for National and Community Service of any particular service or provider. We will send you a list of these resources following the presentation, and they will be posted on the VISTA campus along with the recorded session, so you don't need to write them down during this session. Our goal for this webinar is that you'll know where to go and what to do in order to make an informed decision about the healthcare options that are available to you during your year of service. We will also have time for questions and answers at the end of this session, so be sure to jot down any questions you may have as they occur to you. Before we get to the main part of the presentation, I want to define a few terms for you that I'll be using a lot. The first is copays. A copay is a fixed amount that you pay for any covered healthcare service, usually when you get the service. A deductible is the amount you must pay for healthcare services before your health insurance or plan begins to cover their expenses. For example, if your deductible is $1,000, your insurance won't pay anything until you've met your $1,000 deductible for covered healthcare services subject to that deductible. The deductible may also not apply to all services. A deductible is set by your insurance provider. Out-of-pocket expenses. These costs include deductibles and co-payments and any costs for services not covered by your plan. And premium. This is the amount that you would pay for health insurance, usually on a monthly or quarterly or yearly basis. Again, we'll post these definitions on the VISTA campus following this webinar, so you don't need to write them down. We're going to start at the very beginning and review the Affordable Care Act basics. So the President signed the Affordable Health Care Act into law in 2010. The healthcare law reforms healthcare and ensures that essential healthcare benefits are made available to all United States citizens through state and federal health insurance marketplaces. The law requires all people who can afford it to purchase health insurance or pay a fee. This law applies to all Americans, including VISTAs. The law also reduces the cost of monthly premiums for low-income individuals by offering premium tax credits. It also caps out-of-pocket expenses for qualified health care costs. That cap is set at $6,600 for individuals in calendar year 2015. The law also protects those with pre-existing conditions and resulted in changes to state-based laws. The Affordable Health Care Law is complex. What is most challenging are the differences in how the law is administered state by state. There are many personal variables, such as your age, household income, whether or not you have dependents or are claimed as a dependent, that determine how you must comply with the Affordable Care Act. We in VISTA have tried to provide a substantial health benefit as a safety net to all members serving across the country, despite the state-to-state and individual differences. The bottom line is that you as a VISTA member are subject to the terms of the health care law. To find out how the health care law applies to you, you'll need to factor in variables like the state where you live, your marital status, how many children you have, and whether you can be covered on someone else's plan. So now we're going to move into the changes that we are making to your VISTA healthcare coverage. What we've noted is that given how complex the healthcare law is, there is not a one-size-fits-all insurance plan that can meet the needs of all of our VISTAs in the VISTA program. We have been providing you with a basic health benefit plan that covers your urgent care needs during your year of service. You will continue to have access to this benefit for the remainder of your service year. Please keep in mind that the AmeriCorps Health Benefit Plan does not meet minimal essential coverage provision of the Affordable Care Act. While it is unlikely that any of you will be subject to a penalty due to your low income, if this plan is your sole health coverage, you may be subject to a penalty for tax year 2015. You do have an exemption for the months that you served in 2014. However, this exemption has not carried over for 2015. And we'll talk more about this option later. So what's changing? Well, beginning January 1st, 2015, we will offer a healthcare allowance to all members who maintain insurance during their service year. In order to take advantage of this benefit, you must maintain insurance in order to access the benefit. You're eligible to be reimbursed up to $6,600 for qualifying healthcare expenses during your service year. This is limited to essential health benefits, so elective and/or cosmetic procedures may not be covered. We set the allowance at $6,600 because that is the maximum out-of-pocket expense any American will incur in 2015. The Affordable Care Act stipulates that no American should have to pay more than this amount out of pocket. So that's why we're offering a benefit up to that amount. You can use the allowance towards your annual deductible or coinsurance costs, co-payments for office visits or prescriptions, and any other prescription needs you have. If you choose this option, you will not be eligible to remain on the current health benefit plan. Next, we'll focus on how the healthcare allowance works. So the first step is that you become ill or injured or otherwise need to seek medical services, such as going to your doctor or pharmacy. You'll always want to seek out a doctor or pharmacy in the network of your insurance. At this point, you might be asked to pay a copay. Copays range based on your insurance plan and the type of medical attention you require. For standard treatment, copays are usually between $25 and $40 for in-network services. If you are seeking preventative care, like an annual exam, you'll likely have a reduced fee or it may be free. Following your appointment, you'll submit to our plan administrator a statement of coverage from your insurance. Most insurance companies will send you a statement, often called an explanation of benefits form, indicating what portion of the bill they are paying and what portion you still owe. You'll also submit to us receipts for your copay and any other costs you might have incurred. Next, the VISTA plan administrator will either pay your physician directly or reimburse you for any costs you incurred. In most cases, we'll be able to pay your provider directly and only need to reimburse you for your copay. In some very limited circumstances, your physician may have required you to pay for services up front. In those situations, we'll reimburse you directly if you can provide receipts. So now that you have an overview, let's talk about your two choices. As I shared, we will begin offering the healthcare allowance on January 1st, 2015, and you'll also have the option to remain on our current benefit. We're first going to explore option 1, enroll in the healthcare allowance benefit while maintaining other insurance. At this point, you'll note that a poll has opened up on the right-hand side of the screen. If you choose option 1, the healthcare allowance, you must maintain insurance. So let's see how many of you already have insurance. Take a moment to tell us your status using the poll feature to the right. If you only have the VISTA Health Benefit Plan, you'll need to enroll in a health insurance plan through the Marketplace in order to participate in the healthcare allowance benefit. Otherwise, you will be ineligible for the allowance. If you already have insurance through a family member, yourself, or are already covered by Medicare, Medicaid, or have TRICARE via the Armed Services, you'll only need to submit your enrollment documents to the VISTA program. We'll get to how to do that in a moment. While we wait for the poll results to come in, we'll first review what our next steps will be. For those of you who do not have other insurance, you'll want to pay close attention to these next two steps. I will explain how to get insurance step by step and give you the resources to make an informed decision about this option. There will be a lot of details, and some of the details will speak to people in very different situations than your own situation. The slides for this presentation will be shared with you via the VISTA campus, so for now you can just listen and don't worry about taking notes. For those with insurance, you'll want to hang in to make sure you know how to enroll in the healthcare allowance later on. So as I take note of the results, it looks like, if I'm doing my math correctly, about 100 of you do not have any insurance, and another 150 of you do, and then we have another miscellaneous 150 who either aren't sure or just didn't have a chance to answer, and that's fine. So for the 100 of you who know that you do not have insurance, this is where you'll want to start paying attention. Step 1, what are your health insurance options? The first option is to go to your state's health insurance marketplace by either starting at healthcare.gov or by calling this 1-800 number. Your state's health insurance marketplace can be researched through the nationwide portals. To find out what your options are, you will need to fill out an application. You can fill out an application without having to choose or pay for any particular health insurance plans, and it's the best first step to take, to just simply fill out an application to see what your options are. You can fill out your application in one of 4 ways. Either online at healthcare.gov. If your state has its own health insurance marketplace, healthcare.gov will automatically redirect you to your state's marketplace. You can call 1-800-318-2596 and receive assistance, which is available in more than 150 languages. You can also download a paper application from healthcare.gov. However, if you choose this option, know that there may be a several-week processing lag for paper applications. There are also state and federal government certified assisters, and they go by different names: navigators, certified application counselors, and you can also meet with in-person assisters, or otherwise known as IPAs. Some states have decided to give these certified assisters different titles. You can find local in-person assistance by going to localhelp.healthcare.gov. That was your first step, logging on to healthcare.gov to initiate an application. Your next step will be to shop for coverage and seek financial assistance. Once you've submitted your application, you will be given a report to tell you what healthcare plans you are eligible for. Nearly all VISTAs will end up in one of the following categories. Some people call this an affordability assessment, and you'll be told that you are either deemed eligible for Medicaid in your state, that you may now shop for a compliant health insurance plan, and that you're eligible for tax credits or tax subsidies to make your insurance premiums less. Or you may be told that you are exempt from the requirement to purchase insurance. If this is the case, you may access our health benefit plan, which we'll discuss shortly, and you will not be subject to any tax penalty for not obtaining compliant health insurance. However, in this circumstance, you will not be eligible for the health care allowance. You're only eligible for the VISTA health benefit. You'll receive the report that will tell you which category you fit into, what your options are, and what your next steps are. If you are deemed eligible for Medicaid or for another state-administered health insurance program, your state may have chosen to require an additional application. If you choose to shop for health insurance, you may have a number of different plans to choose from. What you believe is best for you will be highly dependent upon what you want and believe you need from an insurance plan. To help you make some decisions regarding your health insurance options, we're making a number of resources available to you. The first is the vistacampus.gov/healthcare page. Here, we'll post all of our resources related to the VISTA healthcare coverage options, including this recorded webinar, an updated frequently asked questions document that has been updated to reflect the content of this webinar, and the guided resource that we provided to you for today's webinar that outlines your two choices. If you have never bought a health insurance plan, the process may feel a bit overwhelming, and there are a lot of new terms and options to learn about personal decisions to make before you choose and pay for your new plan. It will likely take some time to figure out which plans may fit your wants and needs better than other plans. So before making your final decision about what insurance plan to purchase, you may want some time to study your option. This slide and the next couple of slides will give you information on some of the available resources outside of the VISTA campus. The official resource for the Affordable Care Act and the Health Insurance Marketplace can be found at www.healthcare.gov. You can find a glossary of terms, an application checklist, a number of brochures, fact sheets, and articles, as well as paper applications and eligibility appeal forms. As a reminder, this list is not a comprehensive list and does not indicate an endorsement by AmeriCorps VISTA or the Corporation for National and Community Service. Also, we will be sending or making the slides of this presentation available to you, so you don't need to write all of these resources down. These resources also appeared on page 2 of the document that we sent to you prior to this webinar. If you want to get a quick estimate of what your monthly health insurance premium would cost, you can check out both of the calculators listed on this screen. Both of the calculators have pros and cons. However, if you consider them together, the Kaiser Family Foundation calculator and the Get Covered America calculator should give you a pretty decent idea of what your options are. They're simple calculators to use. You plug in your annual income, what your state is, and it will tell you what options you'll most likely have. Another list of available resources is available here. This slide shows 6 reputable, nonpartisan organizations which have a lot of good resources for consumers. The final resource that I want to highlight for you are the people and organizations that are certified to help you. As I shared earlier, their names are navigators, certified application counselors, and in-person assisters. Some states have decided to give these assisters different titles, but regardless of the title, you can find local in-person assistance by going to localhelp.healthcare.gov. Also important is to take note of the limited times when you can purchase insurance through the marketplace. Right now is open enrollment on the marketplace, and it is the time of year where everyone can shop for and purchase insurance. So if you want to enroll in the VISTA Healthcare Allowance starting in January, you need to start researching your options and shopping now. You will not be able to purchase insurance through the marketplace after February 15th, 2015. There is a special enrollment period for VISTA members. This is the first 60 days following your start date. This can be any time of year. So, VISTA leaders or VISTA supervisors who are listening in, if you have members who are starting outside of open enrollment, they do not need to wait until the next open enrollment period to get insurance. They can do it within the first 60 days of starting service at their site. This would be the first day following their pre-service orientation. All VISTAs will also be able to take advantage of this special enrollment period when you leave VISTA service. So if you end service, let's say next March, and you want to make changes to your health insurance, you can do that simply because you ended VISTA service and you have that special enrollment for 60 days following your VISTA service. If you do not apply during either of these time frames, you will not be able to get a health insurance plan until next year in 2015, unless you have what is called a qualifying life event. A qualifying life event would include a new job, a baby, or a move to a new state. In all cases, you will remain covered by the VISTA Health Benefit Plan until you secure other insurance and submit proof of coverage to our plan administrator. So leaders and supervisors who are listening, if you have members who start outside of open enrollment, we will cover them with our benefit until they seek and secure other health insurance. Okay, our poll showed that about 150 of you already have insurance. For you, this is your one and only step. For those of you who still need insurance, after you purchase a plan, this will be your last step. In order to enroll in the VISTA Healthcare Allowance, you'll need to submit a new Coordination of Benefits form. You submitted one of these at pre-service orientation. We are in the process of updating a new form now. Once it's available, we'll post it on the VISTA campus, vistacampus.gov/healthcare. Instructions for how to send it to the new plan administrator will be included. As I shared with you a moment ago, you will remain covered by the AmeriCorps Health Benefit Plan until you secure other insurance and submit proof of coverage to our plan administrator. Let's revisit our choices again. We've discussed option 1. Now we'll focus on option 2, continuing to rely on the AmeriCorps VISTA Health Benefit Plan. The AmeriCorps Health Benefit Plan provides limited health coverage in a way designated to minimize your out-of-pocket costs. Many of you should already be familiar with this plan because we covered it at PSO, and you've likely reviewed a number of the resources, including the Member Healthcare Handbook. The benefit is currently administered by Seven Corners. Just so you are aware, we will be transitioning to a new administrator, International Medical Group, by the end of December. Current members and supervisors should not see any immediate changes to the administration of the benefit. It will be the same company, resources, and website. As things do transition, we'll provide you with updated information once the transition has been finalized. They will also be our administrator of the healthcare allowance. As I stated, Seven Corners currently administers the AmeriCorps Health Benefit Plan, and you can find resources at www.sevencorners.com/AmeriCorps/ for easy access to the information you need. When the administration of the benefit transitions to the International Medical Group in December, contact information for the new vendor will be shared with you. But you can continue to access Seven Corners to view information about the plan until that time. So, option 2, which is continuing to rely on our benefit. Let's talk about some of the considerations that you may want to take into account. So perhaps you've decided to rely on our existing benefit and will not be purchasing other insurance. You'll want to consider whether or not you have pre-existing conditions, which is any diagnosis made prior to the start of your VISTA service year. Our VISTA benefit does not cover pre-existing conditions. However, we do cover prescriptions related to pre-existing conditions as long as they're not on our excluded list. But that would be the only item we cover related to your pre-existing condition, just the prescription. Our benefit also does not include dental care or vision care, routine vision care. There are some routine examinations that are included, such as a gynecological exam for women. However, other general physical exams are not included. You can view the Seven Corners website and the Member Healthcare Guide for a complete list of exclusions. Finally, the benefit is not considered minimal essential coverage under the healthcare law. This means that if you choose to rely solely on this benefit, you may be subject to a penalty. While it is unlikely that you will be subject to a penalty due to your low income, or that it will be a low penalty, if this plan is your sole health coverage, you might want to consider that that penalty may affect you for tax year 2015. You are exempt on the basis of being an AmeriCorps member for tax year 2014. Information for how to apply for the 2014 exemption is available at vistacampus.gov/healthcare. Let's revisit our choices. As I shared with you, we will begin offering the healthcare allowance on January 1st, 2015. And you'll also have the option to remain on our current benefit. We're curious to know which way you're leaning at this point, based on what you've just learned. Take a moment to select the option you think you will pursue using the poll feature to the right. Your options are 1, either enroll in healthcare allowance benefit while maintaining other insurance. This means you're maintaining or purchasing your own insurance. Or you want to remain enrolled in the AmeriCorps Health Benefit Plan and forego the VISTA allowance. And keep in mind, the VISTA Health Benefit Plan is a limited health benefit plan that does not meet the criteria of the healthcare law. While you put in your choices, I'm going to turn it back over to Andy King, who's going to moderate our question and answer session. Thanks, Andy.
Great. Thank you, Kim, for a really informative presentation, and one that I think a lot of people are really interested in, just based on the rate of participation and the number of questions. So we are leading into the Q&A portion. We've already got a number of questions lined up from the Q&A feature there in WebEx, but also I'm going to turn to our operator for those of you on the phone who may want to ask a question verbally. So operator, can you give us those instructions? All right, well, I don't hear the operator coming in, but if you would like to ask a question by phone, you can press *1 on your touch-tone phone. Make sure your phone is unmuted, and when prompted, please record your first and last name and then hold, and the operator will come in and let you know when it's time to ask your question. And as I mentioned earlier, you can use the Q&A feature, which is in the lower right part of your screen. If you don't see the Q&A block there, go to the top right of your screen. You'll see a little icon with Q&A, and you can click that and open up the Q&A feature. All right, so looks like we have some poll results. Kim, did you want to address those before we dive into the questions?
Sure. It looks like we have 162 of you who have decided that you are either going to maintain the insurance you already have, maybe that you've already purchased or through a family member, or you're going to take advantage of open enrollment to get your own insurance, and then request to be enrolled in the VISTA Healthcare Allowance, which will reimburse you for costs related to your health care. So that's wonderful. About 52 of you have decided that you want to continue to rely on the AmeriCorps health benefit plan and will not take advantage of the allowance. And another 175 of you, so about half of our group here today, have decided that they are not quite ready to make a decision, which is great. During the question and answer period, I'll do my best to reference our resources when I give you my answers. And hopefully by referencing those resources, you'll be able to make an informed decision that meets your needs.
All right. Thank you, Kim. Now we're going to go to some questions that have already come in during the Q&A. So Lynn asked, do we still get health care allowance if we had only VISTA insurance in 2014?
All right, thank you for that question. It sounds like in 2014, which is this current year, you only had the VISTA health benefit, and that's perfectly fine. Your option now, if you want to enroll in the allowance, is to seek other insurance through the healthcare marketplaces. And once you have your other insurance, you'll submit proof of insurance to our plan administrator, and you'll be enrolled in the VISTA Healthcare Allowance starting in January of 2015. So even if you don't have other insurance at this very moment, you do have the option to get other insurance and then enroll in the allowance come 2015.
All right, thank you. We've had a couple of questions come in from folks who are covered under Medicaid, and I'm guessing that others may have similar questions. So first, the general question, Kim, is how does option one, that is, how does the healthcare allowance option work for those who are covered by Medicaid?
Okay. So in most circumstances, Medicaid offers a fairly comprehensive benefit to the people who are enrolled in that benefit through your state. And it's likely that you may never see an out-of-pocket expense. You may never be asked to pay a copay. You definitely don't have any premiums, and you may not have to ever pay for medical services, in which case you just simply wouldn't use the healthcare allowance. However, there are some circumstances with Medicaid where you might have to pay for a prescription, in which case you would either pay for the copay on that prescription, or if you're asked by the pharmacist to pay outright, you would do that. Submit your receipts to VISTA, and then we would reimburse you for those limited out-of-pocket costs. But in most circumstances, those who are enrolled in Medicaid will actually see no out-of-pocket expenses and wouldn't actually need to be drawing down on the health care allowance.
Okay, great. Now as a follow-up, how about OBGYN services for those covered by Medicaid? One of our participants said that OBGYN isn't covered, regular OBGYN visits aren't covered by Medicaid, and so she's wondering if she could then submit those charges for reimbursement under the health care allowance.
I would first say that you should double check on what your Medicaid program does and does not provide for you in your state. The Affordable Care Act requires that prenatal and postnatal services are covered. So your Medicaid benefit may actually cover more than you might be aware of since the time of the enactment of the law. However, if your Medicaid benefit does leave you with some costs associated with your prenatal care, if you enroll in the allowance by simply submitting to us proof of coverage in Medicaid, we would be able to reimburse you for those costs associated with your OBGYN visits.
All right, thanks for that clarification. Now, let's turn to the phones. And operator, do we have any questions that have come in over the phone lines?
We do. Our first question comes from Michael Ashburn. Your line is open.
Hi, it's Michael Ashmore, but either will do. First question is, I actually have two questions. One is on the health care allowance. Is it taxable income if it's a reimbursement?
It is not taxable income because in most circumstances it will either be paying your physician or provider directly, or yes, it would be coming to you as a reimbursement for out-of-pocket costs.
Right, I understand that payments directly to the provider wouldn't be, but I was more interested in the reimbursement piece. So the second component of that is, will you be providing VISTA members some form that indicates their eligibility for the health care allowance reimbursement so that providers can be assured that they will receive a payment in the future from VISTA?
That's really good. That's a great question, Michael. I first want to note, because as I had promised everyone, I'll reference resources as I go through answers. So just to let you know that Michael's question about taxable income is one of the FAQs on our updated FAQ resource at vistacampus.gov/healthcare, just so that you're aware of that. And then on to your second question, which is, what documentation will we be providing to VISTA members so that they can share with their healthcare provider that they are good for the money? And the answer is that to the outside world, our VISTA healthcare allowance will actually look like secondary insurance. We will be issuing members plan enrollment cards and documentation that they can share with their healthcare provider, and their provider will essentially treat it as secondary insurance. They'll first bill the primary insurance that the member has purchased through the healthcare marketplace or has through a family member, and then will come to us second, and we'll either bill our provider directly or may submit the balance of the bill to the VISTA member, who could then send it into us to pay the balance on.
Great, thank you.
You're welcome.
The next question.
We'll take one more from the phone, then we'll go back to the Q&A.
Thank you. The next question comes from Cornelia Hudson. Your line is open.
Hi, I went ahead and put something on the Q&A too. Hello?
That's okay, Cornelia.
Okay.
You can go ahead and ask your question verbally.
Okay, I'm Native American, and I use the Indian Health Services 25 miles from here in Lawrence, Kansas. I'm in Topeka. And I was just told by them that Seven Corners is my primary plan, and they are the secondary. I just want to know what all this means, because I know Native Americans are supposed to be exempt from all this.
Yes. So there are a number of reasons why an individual may be exempt from the requirement of the Affordable Care Act to maintain insurance.
Okay.
One of the primary exemptions that you are certainly familiar with is that if you are a member of a recognized Native American group.
But I don't live where I can utilize their facilities. I have to use Indian Health Services.
Yep. So if you are part of a federally recognized tribe, you are automatically exempt from the Affordable Care Act, which means that you are eligible to remain enrolled in our AmeriCorps VISTA health benefit plan that you have been using so far in your VISTA service, and we will remain primary primary to your
so you will be primary. You will be primary to Indian Health Services too.
Yes, ma'am. You'll want to use you'll want to use our benefit first, and then the other benefit would come in.
Okay, that's what I wanted to find out because I didn't think that was right. I'd been using them all during college, and they never deferred me, and I needed to see a doctor through them, and they were supposed to refer me, and they denied it. That's the first time I'd ever been denied because they wanted to put it over on Seven Corners.
Yep, and that's
contract health. That's what they use.
Yep.
So.
Yep, and so you'll just want to submit any claims that you have to our benefit provider, and make sure that you're visiting with health care providers.
Even preventive. Even the preventive was denied. They're using Seven Corners for prevention too. So they usually go right.
Cornelia, I think your situation actually sounds pretty specific, and maybe there are some crossed wires between Indian Health Services, your caseworker there, and our benefit. So what I would recommend to you is that you actually call Seven Corners, our current provider, and talk through with them what your situation is and what feedback you've been given by Indian Health Services, so that we can address your specific.
They can get a hold of them too and talk to them probably.
Yeah, so that we can address your specific needs.
All right.
Yep. You're welcome.
Okay.
But the bottom line is, for anybody else who knows that they are exempt from the Affordable Care Act requirement to carry insurance, you will be able to continue to rely on our current health benefit plan, currently administered by Seven Corners.
But in January, this is all about ACA. It's not about changing different aspects of your insurance. I mean, it's still going to be there's still not going to be any pre-existing conditions, right?
Correct.
We're still not going to have that.
We're not changing any of the terms of our existing benefit.
Okay.
We're just making a different benefit available to everyone.
Okay, and it has to be with ACA as a partner with it, right?
Correct.
Okay, that's all you're doing. Okay. All right, thank you.
You're welcome.
All right. Thanks for those questions. And now we're going to go back to some that have come in through the WebEx Q&A. Daphne says, if I'm currently uninsured, but I choose to purchase a plan through the Affordable Care Act before January 1st, will I be eligible to receive the $6,600, and she refers to it as VISTA compensation?
Okay. So, Daphne, it sounds like you don't have insurance at the moment. So you'll want to take advantage of the open enrollment period that all Americans have access to right now and purchase insurance through the marketplace. Once your insurance becomes effective, which would likely be early next year, January or February time, you'll submit that proof of insurance to the VISTA healthcare administrator, effectively enrolling you in the healthcare allowance, which is the $6,600 that you referenced. And then to draw down on that benefit, as you incur healthcare costs for going to the doctor and paying co-pays or filling a prescription and paying a co-pay, you'll submit those receipts along with your proof of insurance to our administrator, and our administrator will reimburse you for your co-pays and pay any other costs that you may have incurred.
All right.
And all of that is explained in pretty good detail in the one-page reference sheet that we had everyone download prior to the session, and it's also detailed in the updated frequently asked questions document available at vistacampus.gov/healthcare.
Great. Next up, Jim asks, if I receive medical services outside of my network, will the new health allowance pay any portion of those expenses that aren't covered by my insurance?
So your insurance provider is going to tell you who is in your network, which doctors are in your network, hospitals, pharmacies. When you can, you always want to try and shop for services in their network. And their network is set up. They work with those physicians and pharmacies to set up agreements on costs of services and other rates. So you always want to try and shop for your healthcare needs within your insurance network. In some circumstances, you may find that your insurance provider doesn't have a specific provider that you need within their network, in which case they likely have an agreement with you that you can shop for your service outside of their typical network. And they'll let you know what costs they will cover and which costs they will not cover given that provider is outside of their network. Sometimes it may be full cost, sometimes it may be only partial cost, depending on how your insurance plan is set up. But as long as that service is a covered service based on the Affordable Care Act, so it's preventative care or other essential care, you can submit those costs to us, and we will reimburse you for those costs.
All right. Now let's go to the phone and take a couple more questions from our callers. Operator?
Thank you. The next question will be from Paul Fallon. Your line is open.
Yes. I apologize if I missed this during the presentation, but we had a fire drill, so I apologize for that. But I was wondering, I am eligible for Medicaid right now. Currently, I have no insurance coverage. How would the Medicaid work with the health benefit package? Medicaid would be the primary, and the health benefit package would be the secondary, I imagine.
So, Paul, you must have had your fire drill right when we started Q&A, but I'm happy to go back for you. I've been in your situation before, too, so those fire drills can be annoying at times.
Yeah, I apologize.
Yeah, no problem. So the question is, and it's probably good to review again for everyone, is I have Medicaid. So how does Medicaid interact with our new healthcare allowance that we're making available in January? Is that right, Paul?
Yes, ma'am.
Okay. So because you are enrolled in Medicaid, you very likely have very limited or no out-of-pocket costs for most of the services that you need. However, so you may never draw down on our VISTA healthcare allowance. However, there may come a time where you need a prescription or, visit a doctor that for whatever reason Medicaid does not pay full costs for. And provided that service or that prescription is considered essential, you can submit those costs to us and draw down on the VISTA healthcare allowance. So yeah, it essentially acts as a secondary insurance in partnership with Medicaid.
Okay, can I interrupt just 1 second? I was talking about the package, not the $6,600. I believe it's a package through Seven Corners, the benefits package.
Okay, so for the current health benefit plan that you currently have access to, which is administered by Seven Corners, it is actually primary to Medicaid. So we cover most costs before Medicaid kicks in.
Okay, and then another quick question as a follow-up. When I'm on the application process for Medicaid, they ask me if I have other insurance. Technically, with this, the benefit package, not the $6,600, the other one, the current one that's administered by Seven Corners, would that be considered insurance? Would I answer yes to that question?
No, the VISTA Health benefit, as administered by Seven Corners, is not and will not, come January, be considered insurance. So the answer would be no. It is a limited health benefit plan.
Okay, but it is primary to Medicaid.
Yes, in most circumstances, we get billed before Medicaid gets billed for your services.
Okay. Thank you very much. That's very informative.
Mm-hmm.
All right, and next question from the phone lines.
The next question comes from Sarah Avera. Your line is open.
Hi there, it's Sarah E. Barrera, and my question is concerning the proof that we need to turn in for option 1. Would we need to scan? I have Medicaid, so would we need to scan the Medicaid card and send it over to you guys?
Yes, that would be exactly right. We, however, the only caveat is as of today, as I shared with you, we're currently transitioning from one health benefit administrator, Seven Corners, to a new one, International Medical Group. So we haven't formalized our procedures yet. However, once we formalize those procedures, we will share those procedures with all of our VISTA members. And yes, instruct you to send in proof of your insurance, which could be a copy of your Medicaid benefit card or your other insurance benefit card, along with an updated coordination of benefits form. And we'll share that benefits form with you so that you can fill that out and make sure you submit it correctly.
And I'm sorry, is that with option 2 or with option 1?
That's for option 1 if you want to enroll in the VISTA Healthcare Allowance.
Okay.
If you decide that you want to continue to rely on our current healthcare benefit as administered by Seven Corners, then you would actually not need to do anything because you're going to remain enrolled in it unless you take action to enroll in the allowance.
Okay. And come January, if we choose to go with option 1, Medicaid would become our primary insurance, correct?
That is correct.
Okay. And for reimbursement, once we scan or send you the receipt, how long will it take to be reimbursed?
We are not quite ready to put a time frame on that because I shared with you we are transitioning from one vendor to the next. However, when we sought out vendors, we were very specific with them in describing who our VISTAs are and what they live on each month and sometimes day to day. And we are going to be working with our new vendor to make sure that once all required documents are submitted by the VISTA, that they are turning around those reimbursements in a reasonable and timely fashion.
Okay, and so when we are required to pay up front, does any kind of payment will be accepted, like credit cards, debit, things like that?
That would be up to your healthcare provider, the physician's office, depending on what forms of payment they may accept.
Okay, so if we just show the VISTA card or the insurance card that we will get from you, they won't accept that. It needs to be like a downright form of payment.
Oh, I see what you're saying. So, and this is good for everyone to hear. When you need to seek medical services, whether it's preventative care or whether you think you have the flu or whatever the case may be, if you have Medicaid or whether you have other insurance, you're going to want to see a provider within your Medicaid or insurance network. You'll go, you'll schedule your visit, you'll seek the services you need, and in most circumstances, that provider is only going to ask you for a co-payment. For Medicaid, they may not even require anything. But they may require a co-payment, which is usually somewhere between $25 and $40, depending on what insurance plan you have. And you'll pay that out of pocket. There will likely be a balance that you owe that provider for whatever services that you were there for. And they will first bill Medicaid or they will first bill your insurance provider for that balance. And then they may finally send you a bill that says your insurance provider or Medicaid isn't paying this, in which case you'll submit that to the VISTA Healthcare Allowance Administrator, and the administrator will pay the doctor directly, so that your only out-of-pocket costs would be that copayment, that $25 to $40 copayment. In very limited circumstances, small, one-shop, physicians may say that they need you to pay the full cost of whatever service they did on site that day you received the service. And in those circumstances, you would just need to work out an agreement with them to pay that cost, and then, of course, submit the receipt to both your insurance provider to see what they will pay, and then to us for us to pay the balance for covered services.
Thank you.
All right. Thank you for that, Kim. Next, we're going to go to a few questions from the Q&A. Kerr asks, what's the best thing to do if I'm going to relocate to a new state after my VISTA term ends? If I apply for insurance in the state where I'm currently serving, will it transfer over to my new state?
So, you'll always, if you're seeking new insurance now, you'll want to seek an insurance provider for the state in which you're serving, so that you can seek, medical services during your year of service in your local service area. If at the end of your service year, you relocate back home to your home state, or you just move to another state, that is what we call, and what the healthcare law calls, a qualifying life event, which means that you would have the option to go back to the health care marketplace and make any changes you'd like, get a completely new plan, or just upgrade your plan to a new health insurance plan if you so choose. There are some health insurance plans that cover multiple states, or may even have somewhat of a nationwide network. Some of the bigger names like Blue Cross Blue Shield, Aetna, and the like tend to have a much wider coverage area that may go across state lines. However, what I would recommend is that as you're ending service and you're making plans to relocate, that you take a look at your insurance plan, see where it does cover, see where it doesn't, and then if you need to, take advantage of your qualifying life event, which is moving, and shop for insurance that's going to meet your new needs in your new state.
All right, great. A couple more questions regarding how the healthcare allowance can be used. So Brenda asks whether the healthcare allowance can be used to cover expenses related to routine dental and eye care.
This is a really good question, and it's a question that we received a lot when we initially had this webinar a few weeks ago. So we made sure that we added this specific question to our frequently asked questions list at vistacampus.gov/healthcare. And the answer is that our allowance reimburses for costs associated with qualifying healthcare expenses. And those qualifying healthcare expenses are available at the healthcare.gov site. And we have a link on our FAQs that tells you what are essential health benefits. You can also contact your health insurance provider to find out what is considered essential. Specific benefits do vary by state and by insurance provider. However, in general, dental and vision care is only considered an essential benefit for pediatric services. So in most cases, you wouldn't be able to apply the allowance for dental care because it is not considered an essential health benefit per the Affordable Care Act.
All right, great. And now related, can the healthcare allowance be used to pay private insurance premiums?
Again, another very good question and another frequently asked question. can you use the VISTA healthcare allowance to pay for your premiums? And as a reminder, to those of you who may be hearing some of these words for the first time, a premium is the cost you pay to maintain your insurance plan. It's usually a monthly, quarterly, or an annual rate that your insurance company sets. And the answer is no, you cannot use the VISTA healthcare allowance to pay for your premiums. That being said, I want to just let everybody know that if your VISTA living allowance is your only income, which in most circumstances, I think most of you are single, and this is your only income, it is likely that you will have very low premiums. They may be as little as $0 a month, maybe up to $25 a month. And that's because your living allowance is so low that the federal government is making tax credits and subsidies available to you to help offset the cost of premiums.
All right, great. Operator, let's go to the phone and take 2 more questions there.
Certainly. The next question comes from Patricia McCormick. Your line is open.
Hi, yes. One of them actually got answered, the part about the premium. When I investigated the Affordable Care Act healthcare website last year, they told me that my premium would be over $500 a month. And I wouldn't get any subsidies because I actually had taken withdrawal from a 401 to put down on a house. Mm-hmm. And so it made my annual income, a lot higher than it actually is now, actually. And so now I'm in this VISTA position and my salary is low and I don't have, I'm in a state that doesn't have that Medicare expansion. And it's a Tennessee, and so I'm like kind of not knowing what I should do, if I should just keep the benefit as it is, because I can't afford $500 a month.
Right. Thank you, Patricia. I'm gonna kind of generalize your question so that everyone kind of hears the answer that may apply to them. So while most of our VISTAs are coming into VISTA service without any, pre-income, they don't have 401ks or mortgages, or, they didn't come from being a Wall Street broker before becoming VISTA, we do recognize that there are some VISTAs who might have excess income that may or not actually be helping them during their year of service. And when you visit healthcare.gov and you're inputting all of that information, last year it might have told you that you weren't eligible for subsidies or tax credits. There have been changes since last year. More states have decided to expand Medicaid. The government has changed some of its tax rules regarding health care. So I would, encourage you to go back to the marketplace and reapply and see what you may or may not be eligible for. And you also have the option to seek an exemption from the Affordable Care Act rule that you maintain insurance. And once you seek that exemption, whether you seek that exemption or not, you can always, since you're a currently serving member, can continue to rely on the VISTA Health Benefit Plan, Limited Health Benefit Plan. And if we have new members come January who are in a similar situation to you, they also will be able to apply for exemptions and rely on our health benefit plan. So I guess my specific answer to you, Patricia, is to go back to healthcare.gov and see if you can, reapply this year, since things have changed over the past 12 months, to see if there are any additional subsidies or tax credits or options available to you. If you find you're not really getting information that you need right on the website, I'd encourage you to reach out to one of the in-person assisters who can help you. And you can get that by, I think it's localhelp.healthcare.gov.
Okay. All righty. Thank you.
You're welcome.
And do we have another? Oh, go ahead, please.
Yes, the next question comes from Gabrielle Baptiste Newman. Your line is open.
Thank you so much. Good afternoon, everybody. Basically, the caller kind of answered my question, but I wanted to know what makes you qualify for Medicaid. Is it going by the gross income, the net income? Is it qualified yearly? Is it monthly? Like, I just want some clarity.
Absolutely. So Medicaid is, funded in part through the federal government, is actually administered on a state-by-state basis. And each state has its own application process and rules for how they implement the Medicaid benefit. So you'll want to check with your state on Medicaid eligibility. But generally speaking, it is based on your household gross income. So not only your income, but the income of anybody else that, lives in your home with you, parents, spouse, children, so on and so forth. And it is gross income, usually before taxes. And that's what they use to determine whether or not you qualify for Medicaid in your state.
I'm sorry to cut you off. So if you're at the healthcare.gov website and he asks you the question, like, what's your expected household income from 2015? I mean, are you answering that on a salary basis or a monthly basis?
You're going to want to do that on your annual gross household income, the total amount of income you expect to receive in 2015 for your household.
Okay.
Mm-hmm.
All right. We've got a couple related questions that have come in through the Q&A, and this is relating to the AmeriCorps Health Benefit Plan and Medicaid and Medicare. And in both cases, they ask, can I keep both? Can I have the AmeriCorps Health Benefit along with Medicaid or along with Medicare?
The answer is yes. Existing AmeriCorps members, so members who start service before January 1, 2015, do have the option to remain on our existing health benefit plan and maintain Medicaid or Medicare. Members who come on board January 1, 2015 and after will not have that option. They will have their Medicaid or Medicare, and they can enroll in the health care allowance, and that's their only option.
All right, great. Next, Emily asks if she could take advantage of the health care allowance if she's covered on her parents' insurance.
Hi, Emily. Yes, yes, you absolutely can. So if you're covered by your parents or a spouse, you may submit claims to us for covered essential health benefits for your health benefits. So you can't submit your dad's cost to us, but you can submit your own, and we will reimburse you for those costs.
And then related to that, Emma asks, for VISTAs who are covered by family insurance, do they have to use the health care allowance, or do they have a choice of both options?
Existing members, so members who start prior to January 1, have the option to remain on their parents' insurance and either opt into that health care allowance to be reimbursed for health care expenses, or remain enrolled in the VISTA Health Benefit Plan. VISTAs who start service January 1 or after, who are covered by their parents, will only have the option of the health care allowance.
All right, great. Let's go back to the phone and see what questions we have there.
The next question comes from Lindy. Your line is open.
Hi, I believe it's already been answered in reference to the total income. So I'm going to guess that that includes Social Security if that's coming in as the added income.
You know, I'm not an expert in tax and income law. So what I would recommend to you is when you're at healthcare.gov, they have usually most of their resources are linked. So if it's asking you for your annual income, there's usually like a little question mark box or income is highlighted, and you can click that and it'll actually define that term for you. If it's not set up that way, then you can actually use their search button or their search feature to figure out what the definition of annual income is and what is included and what is not. So I'm not certain as to whether or not Social Security is counted as income or not, so you'll just want to double check that by doing some research on healthcare.gov.
All right. And then
just so you know, I just went to healthcare.gov and I typed in annual income into the search box, and one of the first results is how to report income on the marketplace, and so it tells you, you know, what to cover and what not. So it's a good resource there.
With this change that's taking place and that we are required or requesting additional insurance, does that allow us to get a second job?
The changes to the VISTA health benefits have no relationship to any of the other terms and conditions of service. Okay. So we are not making any changes to whether or not VISTA members can work while they serve.
Okay, great. Thank you.
Mm-hmm.
There are no other questions in queue at this time.
All right, we'll go back then to the Q&A. We still have a number of questions here. So Dorothy asks, can a recently enrolled VISTA, meaning someone who started, I'm guessing, this month, choose to enroll in health insurance as late as February 15th? Or does it have to be done within the first 2 months of service?
So members who are currently serving right now, whether you started 10 days ago or 10 months ago, you are all in what we call open enrollment. So all Americans right now can go to healthcare.gov and enroll in insurance. And open enrollment does last until February 15th, 2015. So you have from now until February 15th to shop and enroll in a health insurance plan if you choose. Once you have that health insurance, you would submit that proof to us if you wanted to enroll in the health care allowance, and you'd need to do that on or by February 15th, 2015. For members who start service after open enrollment, so February 16th, 2015, they will only have access to the special enrollment period given to AmeriCorps members. They'll be outside of typical open enrollment, and they will need to shop for and purchase insurance within really the first 30 days of their VISTA term so that they can have insurance active by their 60th day so that they can submit that proof to us and we can enroll them in the allowance. During any gap from service start date to that 60-day mark, we will cover them by the VISTA, under the VISTA health benefit for urgent care needs. And those timelines are outlined in the frequently asked questions at vistacampus.gov/healthcare.
Great, thanks, Kim. The next question is relating to the healthcare allowance and mental health care. So the question is, can the healthcare allowance be used to reimburse out-of-pocket expenses for mental health that's not paid by their insurance plan?
Yes. So the great news here is that the Affordable Care Act, the health insurance or health care law, means that mental health and substance abuse use disorder services, including behavioral health treatment, counseling, and psychotherapy, are all considered essential health benefits. So if you have other insurance, you can seek out those mental health services, and because they are considered an essential health benefit, you can submit for reimbursements of using the VISTA Healthcare Allowance for those associated costs.
All right, great. A few more questions. So this is related to the transition from Seven Corners to International Medical Group. Jeff asks, what happens if you have a claim from a couple months ago that still hasn't been resolved by Seven Corners? What's going to happen December 15th?
Okay. So Jeff, what I would recommend is if your claim hasn't been resolved from such a long time ago, that you take time today or tomorrow to call Seven Corners directly to see what you may need to do or what information they may need from you in order to process your claim. But the bottom line is you will not see any change in services from Seven Corners to International Medical Group. International Medical Group is going to honor, all prior claims that Seven Corners was working on. Essentially, this is just, for VISTA members, this is really just a name change. Ultimately, the VISTA program, ensures that the benefits are operating, and so our VISTA members should really see no change in services. It's really just changing one name to the next. All the terms of the benefit are going to remain the same, and claims that are being processed right now by Seven Corners will be resolved by International Medical Group.
Great. And then related to that, someone else had asked whether they could keep their same doctors and providers as once the transition takes place.
Mm-hmm. And the answer there, I believe, is the same. We're really just having a name change. When we contracted with this new provider or administrator, we wanted to make sure that there were some consistency in the providers that were available to our VISTA members. However, it is really ultimately up to the healthcare provider whether or not they want to enter into an agreement with any health insurance group or, health benefit provider the way we're set up. So you'll always want to double check the website to make sure that your provider is still within our network. But we do have agreements set up with International Medical Group to make sure that there are a decent amount of choices for our VISTA members when it comes to their health care.
Great. Another question, can you explain more about the penalties for not having ACA compliant coverage in 2015? For example, will I be penalized for not having ACA compliant coverage for 2 months of the 2015 year?
That's a really good question. And first I want to just say that the penalties are assessed by the Department of Health and Human Services in conjunction with the IRS. So AmeriCorps VISTA does not have any, we don't weigh in on what penalties should and should not be. But I can give you some general information. Starting January of this year, of 2014, the healthcare law stated that all Americans who can afford it need to maintain insurance. So VISTAs who elected not to get other insurance in 2014 2014 typically would have been assessed a penalty. However, we got a waiver from the Department of Health and Human Services for this transition year. However, come January 1, 2015, that waiver expires. So if VISTA members or any American in 2015 don't have insurance, when you file taxes for the 2015 tax year, which would actually be January 2016, you may be assessed a penalty for any months where you did not have adequate health insurance coverage or Medicaid, Medicare coverage. I do believe that penalty is prorated for the months that you did not have coverage, and it is set at a rate of either a flat fee of $95 or up to 1% of your income.
All right, great, thank you. Certainly complicated stuff, especially when it gets into taxes and penalties for the coming year, which we don't yet have experience with. Operator, let's turn one last time to the phones to see if there are any remaining questions there.
Currently, there are no questions. Again, if you would like to ask a question, please press *1. Be sure to record your name.
All right, well, we're going to...
you know what, Andy? I just want to make a correction. Andy was absolutely correct when he said there are some things we haven't anticipated for, that this is a complicated issue. While I was waiting for the next question, I did go to healthcare.gov and I searched for penalty and found out that there is a different fee in 2015. And it states that if you don't have coverage for 2015, you'll pay one of these two options, either 2% of your yearly household income or $325 per person. So last year it was only $95 per person, but next year it will actually be $325 per person. So that's definitely something that if you're considering not maintaining other insurance, you'll definitely want to go to healthcare.gov and look at the fees and penalties that you may end up paying if you don't have other insurance for any period of time in 2015.
All right, great. Thanks for the clarification. Well, we're almost to the end of our time together, and it's possible that we've missed your question, and if so, I do want to apologize because we've had a lot of questions, and reading through them, there's a bunch of overlap, so it seems like we've covered most everything, but just want to see if we can answer just one or two more. Juliana says, once we end our VISTA term, will that count as a qualifying life event, allowing us to change our health insurance coverage?
And the answer is yes. Ending AmeriCorps service is automatically a qualifying life event, and you have 60 days following your end of service date to make any changes you'd like to make to your health insurance. And that is the process we're seeking. That special enrollment period is outlined in the frequently asked questions document on the VISTA campus.
All right, well, great. That's a great question to end on, and we know that you probably still are curious to learn more details about this. So as Kim mentioned, the VISTA campus has tremendous resources. We will be posting a recording of this session, so if you want to go back and listen again or point some of your fellow colleagues, VISTAs, to it, it'll be available there, and we'll follow up in about a week or so once it's available by email to let you know about that. And so I just want to invite you to complete an evaluation about this session once we sign off. If you stay at your browser, you'll automatically be redirected to a quick little survey, just a few questions. We want to get your input and answers to help us improve the quality and relevance of the sessions that we're providing you, and also to get your ideas for topics that we can present in the future. And then I also want to leave you again with some ways to get in touch with us. The web address for all of this information is www.vistacampus.gov/healthcare. And if you have questions about webinars, you can email us at vistawebinars@cns.gov. So I want to take this time to thank Kim Judy from the New York State Office of CNCS for a really tremendous presentation of pretty complex information, but she makes it so understandable and clear. I also want to thank my colleagues who've been helping in the background here with question and answer and chat things. So Kate Baldes and Jennifer Veazey, Josh Walker, and Andy at Education Northwest for all of your support during this session. And thank you for joining us. That's the end of our presentation. We hope to see you again very soon.